So my name is Raewyn Seaberg. I'm a surgeon in the Division of Otolaryngology Head and Neck Surgery at Humber. I've worked at Humber for the last 9 years. As otolaryngologists, head and neck surgeons, we're lucky because we have medical treatments that we can offer patients as well as surgical treatments. We see a full spectrum of ages, so I have patients that range in age from newborns to patients that are more than 100 years old. And within that group, there's some who only ever need medical therapy, there's some also who need surgery. So the days are spent seeing those patients in the office or clinic, and as well as working in the OR on the ones who need surgery. So intraoperative PTH is a blood test. It takes advantage of the fact that PTH, or parathyroid hormone levels in the blood, change very quickly. So the half-life is very short. And what doing this test intraoperatively allows us to do is allows the operating surgeon to know with certainty that they have fixed this patient's parathyroid disease. So in real time, we can measure the levels dropping and be sure as surgeons that we have removed all of the diseased parathyroid glands during the course of the operation. So this is an exciting test for Humber. I think it's a good example of the blending of medicine and surgery working together. And I want to mention my colleague, Dr. Atusa Rizvanpour, who's a clinical biochemist here at Humber. And it was really working together with her collaboratively that allowed us to put this protocol together. And so I would be remiss not to mention her and give her the accolades that she really deserves from her end. Not every parathyroid patient needs to have this as an adjunct to their surgery, but there's a subset of patients who benefit, and that's because parathyroid glands can be tricky. They can be in different places within the neck. Some patients will have one diseased gland, others will have more than one diseased gland, and it's not always obvious preoperatively or even intraoperatively which are the glands that you need to remove. And so in the past, when we had patients who would benefit from this, but we didn't have it available, we would either need to do a larger operation than necessary and try to find all of the glands and look at all of the glands to evaluate them, or we would need to send these patients to a center that already has this technology. So for example, some of the downtown teaching hospitals have this available, and so we would need to send them elsewhere to have their procedure and their surgery done. Now that we have it available at Humber, we can keep those Humber patients here at Humber and offer them that in the context of their surgery here. Well, we did the first case last week, and it was such a nice example of working with other parts of the hospital. As surgeons, especially in our subspecialty, we have relationships with pediatricians, endocrinologists, nephrologists, lots of different specialties, and now we have this really nice, close working relationship with the lab as well, because it's really a collaborative effort to get these tests done. It's lots of communication between the OR and the lab on the day of the procedure, leading up to it, but also on the day, and it all comes together in a really nice team effort for the ultimate benefit of the patient, which is why we're all here.